What are mast cells and what does mast cell activation refer to and how does it relate to migraine?
Wow. Okay. These are all great questions. And here's the thing. They're all related. So autonomic dysfunction is related to mast cell dysfunction. Gut dysfunction is related to mast cell dysfunction. And certainly migraine is related to mast cell dysfunction. And mast cells are in every one of our organ systems. They are on the surface of our brain. They're in our lungs, our kidneys, our heart, but they also play an intricate role in protecting our gut health from exposure to normal pathogens, meaning like normal stuff in our environment that our gut might get exposed to. But some of our patients with migraine have two active mast cells, which means that if their body's exposed to something that doesn't want to be around, instead of a minor blip of inflammation to take care of the problem, the body goes into this big storm experience where that mast cell releases not just histamine, which is commonly attached to migraine, but it releases other inflammatory proteins that cause stomach dysfunction, that cause the lining of the brain to get swollen and engorged, or causes nerve cells to be more pain sensitive. So that our patients who have mast cell dysfunction, which sometimes shows up as skin rashes in the body for no good reason, or inappropriate flushing episodes of the face and chest that gets red for no good reason, those people commonly have gut dysfunction, where they had abdominal pain from food exposure, and they've got numerous food intolerances, foods they can't eat because it makes them feel sick or unwell, or makes them feel just kind of gross in general.
Is this common? I mean, some of the things that you mentioned are some things that I've experienced personally or heard other people talk about. Is this a common thing that you deal with your patients?
Yes, the short answer is yes. And Wendy, the long answer is a bit more complicated because everyone in the world has mast cells. And for everybody, they're doing what they're supposed to do. We just know that some people are gifted with more sensitive mast cells than they're supposed to be. So if you take 100 people and they're all exposed to the same type of stimulus, maybe like a scratch of their skin, only 5% or so will develop an inappropriate response to that we think is mast cell derived. And we know that people who have migraine are more prone to have mast cell sensitivity than people who don't have migraine. And we also know that if someone has an active mast cell response in their gut, they're going to have an active mast cell response elsewhere in their body. There are even some people who believe that mast cells are part of the underpinnings for all of migraine because they play a role in squirting out inflammatory substances to the surface of the brain as part of a regular migraine experience. It's just if you're prone to have more active mast cells, it makes it easier for your body to trigger that migraine response in people.
Is it on a spectrum then that you can have some level of dysfunction with mast cells, but not be as serious as sounds like some people it's incredibly serious, but is there a spectrum of how it can affect you?
Wendy, you're 100% correct. So most people have normal, happy, active mast cells that are doing what they're supposed to and don't cause any trouble at all for people in their day-to-day activity. And then some people have the same mast cell issues, but they have way too active mast cells. We call that mast cell activation disorder. And then we've got people who can move between those categories on a spectrum.